Is your baby spitting up? Get answers for infant reflux. If you've ever overindulged on fatty food or drank too much coffee, you're probably familiar with gastroesophageal reflux, or the movement of stomach contents up into the esophagus. For adults, reflux is usually caused by these kinds of lifestyle choices and has telltale symptoms like burning chest pain and belching. Reflux is also a common problem for infants and babies. But instead of experiencing heartburn, they're more likely to spit up formula or breast milk, and the causes are very different. Reflux isn't an acid problem in the majority of babies, explains Dr. Rachel Rosen, director of the Aerodigestive Center at Boston Children's Hospital. What's more, it's often treatable without medication. Here's what Dr. Rosen says every parent should know when seeking answers for infant reflux. 1. They'll likely outgrow reflux. In infants, reflux typically occurs when the lower esophageal sphincter, LES, relaxes, letting stomach contents escape into the esophagus. This relaxation is normal, but can happen more frequently in some babies. The diaphragm and stomach are also important in supporting the lay, so when one or both aren't working properly, reflux may worsen. Many babies with reflux will outgrow it by the time they are about 1 year old, as the lay becomes stronger. 2. Spitting up is usually normal. Symptoms of reflux can vary, but babies with this problem generally tend to spit up after feedings, make gagging, choking or coughing sounds and act fussy around mealtime. That said, spitting up is a normal occurrence for young infants. As long as your child is growing well and not developing other problems, such as breathing difficulties, treatment probably isn't necessary, says Dr. Rosen. 3. Feeding fixes are key. When you have a fussy baby, your instinct is to feed your baby, but that can just make reflux worse in these kids, explains Dr. Rosen. Along with avoiding overfeeding, babies with reflux may respond well to thickened liquids, typically formula or breast milk that has been thickened with added rice cereal or oatmeal. The heavier you make a liquid, the more likely it is to stay in your baby's stomach. This can also add calories, which is important for babies who have trouble gaining weight. 4. Medications often aren't the answer. Doctors used to prescribe medications like antacids and acid blockers for months and even years to treat reflux in babies. However, recent advances in testing and research have shown that acid isn't the problem in most infants with reflux. In fact, studies suggest that these drugs don't seem to help with most symptoms. Worse, a class of medications called proton pump inhibitors has been found to have some worrisome side effects in kids, including increased respiratory infections, fractures, allergies and hospitalizations. If your doctor prescribes PPIs, Dr. Rosen recommends limiting use of these drugs to no longer than 1 or 2 weeks to determine whether or not they're helping your child.